Hi to everyone. This is Dr. Lakshmi Aswathaman, working as a senior consultant and a clinical coordinator at MGM Healthcare, Chennai. It's been a privilege and a pleasure to serve my fellow women for the past 40 years. And at the outset, I would like to wish all my fellow women a very happy Women's Day. Swami Vivekananda once said, the best thermometer in the progress of its nation lies in the treatment of its women. There is no chance for the welfare of the world and our country unless the condition of the women is improved. Also, Manu, who gave us the great Manu Shastra, had said, where women are honored, there resides the gods. So it is when they have given so much importance for us, why is it that we are not taking up our responsibility and the rights to our health care as well as economic empowerment? Women's health does not equate just to pregnancy and the diseases of the woman and menopause. It starts right from childhood until menopause and beyond. So in childhood, it is the parent's duty to make sure that she is given the most nutritious diet in order to give her a very good, healthy reproductive system and keep her stress-free so that she does not get diseases like polycystic ovarian disease. So it is the parent's duty also to make sure that there is no gender bias and their sons and daughters are treated equally in respect to giving education, the nutritious diet, and the various aspects of empowering the women. So in childhood, it is our duty to make sure that the children are nourished as well as receive their proper vaccinations at the proper time. Regarding vaccinations, it is very important for us to make sure that the girls are up to date in their vaccination in respect to mumps, measles, and chicken pox, as well as vaccination against cancer cervix. All these have to be given before they reach adolescent or in their early adolescence, before they start their sexual activity, because the first three vaccinations are going to prevent congenital defects in the baby, so as well as getting affected in a very serious way at a later stage. The vaccinations against cancer cervix is given well before the girl starts her sexual activity. So it's very important to get 100% coverage by giving it at the right time. It can be given after marriage, but the coverage is only 66% versus the 99% protection which is given to a girl who takes the vaccination before she gets married. Regarding the antenatal care, it starts well before the patient becomes pregnant. Pre-pregnancy counseling is a very important part of the antenatal care itself, even before she gets pregnant, especially those who are suffering from diabetes, epilepsy, and other diseases. They have to keep their health status at a very optimal status in order to get a very healthy outcome out of the pregnancy. So pre-pregnancy counseling is an important part of the health care that we give to the women. Regarding the antenatal care, the appointments have to be followed very well. They have to undergo the investigations which are done and the antenatal care throughout her pregnancy, which as prescribed by the obstetrician as and when necessary. Prevention is better than cure. So it's very important that we have an annual checkup like men. And that includes CBC, thyroid function test, ultrasound of the pelvis to rule out any problems in the uterus or ovaries, as well as pap smear. Pap smear forms a very important part in catching the cancer cervix very early, even before the cancer develops. So please do not neglect or refuse that investigation, which is a very important part of women's health care. Yeah. Motherhood is an important part of any woman. So please do enjoy the motherhood, the pregnancy part of it, by taking care of yourself and your little one by a proper antenatal care, by proper antenatal protocols and the investigations which are advised to you. Please do remember to do the fetal screening by the ultrasound and the double marker first trimester serum screening to rule out any abnormalities, which forms a very important part of the antenatal care. Please do not refuse it. And please do take care of your nutrition throughout pregnancy and report all the problems which do come immediately to your antenatal caregiver. During labor, please do insist on continuous fetal monitoring either by the fetoscope or by the cardiotocogram. MGM has what is called a Monica Novae, which allows an ambulatory monitoring of the fetus, which allows you to move around even though the fetus is getting monitored by the cardiotocogram. Throughout life, it's very important to take care of yourself in terms of deficiencies, which can lead to various diseases like anemia, muscle weakness, etc. So please do correct yourself for an anemia, which includes iron deficiency as well as folic acid and B12 deficiency. Vitamin D deficiency is a very common problem in our country because we don't expose ourselves to sunlight. Please do check on those levels periodically and correct as and when necessary. That's very important in order not to develop osteoporosis during pregnancy or menopause, which can lead to weakness, body aches, as well as unwarranted fractures of the neck of femur or vertebra. Geriatric women health is last but not the least important. Most of our problems do come post menopause or perimenopausal age group. So the things that to be discovered during that period is screening for the most of the cancers which happen to occur during that time by doing a proper ultrasound as well as the pap smear, including the HPV DNA testing. We can screen for osteoporosis by doing the DEXA, which is the bone densitometry, and by doing that we can correct if it is present by giving the calcium and vitamin D and bisphosphonates if the supplementation doesn't help. Overall health means health of the body and mind. It's just not enough to improve your physical health alone. Looking after your mental health is as important as looking after your physical health. Please do not hesitate to discuss your mental problems with your family and the physicians who care for you. Especially women, because of our hormonal changes, we are prone for a lot of mood swings and depression. So please do discuss about your issues with your spouse as well as your family as well as your physician. Regarding advancements in the women's medical health care, I would like to mention about the keyhole surgery, which has been going on for the past 3-4 decades, but still a lot of improvements have been made with that. The surgical techniques have been improved a lot. Robotic surgeries have come into place where a robot does the surgery in the place of a physician who is directing the robo from a distant place. Geriatric women's health includes a screening for cancers, mainly the breast cancer and the cervical and uterine cancers, as well as ruling out osteoporosis by doing the DEXA, as well as ruling out all the vitamin deficiencies which can happen because of neglecting their nutrition. Please do not get intimidated with all that I have said. For everything there is a cure. Please make use of all the medical services that are at your disposal, and we at MGM Healthcare are privileged and have the pleasure to serve you all at any time. please do make use of our services.